February 19, 1994, Riverside General Hospital, California, 8:15 p.m. A woman is dying, but what happens next will turn an ordinary emergency room into a hazmat zone and send 23 medical professionals to the hospital themselves. This is the story of Gloria Ramirez, known forever after as the Toxic Lady. A woman so toxic she poisoned an entire ER with her own blood. Gloria Ramirez was 31 years old, mother, cancer patient, and on this February night she was in crisis. Cervical cancer had ravaged her body. Now her heart was failing. At 8:15 p.m., paramedics wheeled Gloria into Riverside General's ER. She was barely conscious, breathing rapidly, her blood pressure dropping. The ER team sprang into action. Dr. Humberto Ochoa led the code. Nurse Susan Kane started an IV line. Standard emergency protocol, nothing unusual, until they drew her blood. Nurse Susan Kane pulled back the syringe and immediately noticed something wrong. The blood had an unusual sheen to it. An oily, garlicky smell filled the air around the IV line. Chemical, wrong. Then Susan Kane looked at the blood tube in her hand and saw something that shouldn't exist. Crystals, floating in Gloria Ramirez's blood. Moments later, Susan Kane's world started to spin. Her face went numb. She couldn't breathe properly. She collapsed. Respiratory therapist Welch tried to help, and she went down too. Mouth numb, legs buckling. One by one, staff members began dropping. Confusion, dizziness, difficulty breathing. Dr. Ochoa made a split-second decision: evacuate the ER. The code continued with a skeleton crew wearing protective gear. But it was too late for Gloria Ramirez. At 8:50 p.m., she was pronounced dead. Behind her, she left 23 sickened staff members and one terrifying question: what the hell just happened? In the aftermath, Riverside General's ER looked like a crime scene, because, in a way, it was. The hospital sealed the room. The California Department of Health Services launched an investigation. So did Lawrence Livermore National Laboratory. The theories came fast. Mass hysteria, environmental contamination, bioterrorism, all seemed unlikely. The answer was in Gloria's blood. Gloria Ramirez had been using DMSO, dimethyl sulfoxide, a popular home remedy for pain. Some cancer patients swear by it. Here's what investigators discovered. When the ER team gave Gloria oxygen, they may have triggered a chemical chain reaction. Theory: the oxygen, combined with the electrical charge from the defibrillator, converted the DMSO into dimethyl sulfate, a known poison. When they drew her blood, opened those tubes, exposed it to air, they released toxic fumes into an enclosed ER, causes exactly the symptoms the staff experienced. But here's the controversial part. This has never been definitively proven. Some experts called it chemically impossible. Others stood by it. Of the 23 staff members affected, most recovered within weeks. But some, like Dr. Julie Gorczynski, suffered lasting effects. Gorczynski never fully recovered. She developed a vascular necrosis and had to leave healthcare entirely. She sued and lost. It raised an unsettling question. Can a human body become toxic? Can we poison others without even knowing it? Gloria Ramirez didn't choose to be toxic. She was a victim of cancer who became a medical mystery, seeking help, seeking pain relief. The Gloria Ramirez case remains one of the strangest medical mysteries in modern history. A woman sought help and left a puzzle scientists still debate. Next time on Toxic Humans, Typhoid Mary. Visit unbedsidemanners.com to learn more about Gloria's story and other medical mysteries.